Hello and welcome to Systemic Anatomy and Physiology. My name is Chrissy Martin and I am the convener for this unit. Getting straight into it, we start our series of lectures by looking at terminology. If you've studied regional anatomy and physiology prior to this unit in semester 1, then a lot of this content and the content of the next two lectures will be quite familiar, but it never hurts to have a bit of a refresher. So many of the terms that we use in the study of anatomy and physiology derive from Greek and Latin. What this means is that learning anatomy and physiology can be like learning a whole new language. Although these words initially are going to seem really strange and foreign, as we move through the unit, you will see some of these words or parts of words over and over again, and eventually this terminology will become quite familiar. So to help us get to that stage, we have 3 learning objectives to cover today. To 1, differentiate between anatomy and physiology. 2, to use anatomical terms for body direction, regions, and planes. And 3, to be familiar with common roots, prefixes, and suffixes. So getting started, learning objective number 1, to differentiate between anatomy and physiology. So anatomy is a study of structure. Anatomy describes how something is made up. For example, if I were to ask you to describe the anatomy of the blood vessel on this slide, I would be asking you to describe what it looks like. So you could say that the blood vessel is a round, hollow structure, that it's surrounded by endothelial cells with small gaps or spaces between those adjoining cells. Physiology is then the study of how body structures function. So if you were to describe the physiology of the blood vessel on the slide, you could say that blood flows within the lumen or the hollow of the blood vessel, that various substances, nutrients and waste products will diffuse in and out of that blood vessel, and that they move through the spaces, the small spaces between those endothelial cells. So anatomy is what something looks like, whereas physiology is how something works. Moving on, and learning objective number 2 is to use anatomical terms for body direction, regions, and planes. So a plane, in this context, is a 2-dimensional slice through a 3-dimensional space or object. In anatomy, when we describe a particular body region, a bone, a muscle, an organ, we describe them as being in one of these 3 planes. So we have our sagittal plane, which is this one running through here. And the sagittal plane divides the body, in this instance, into a left and a right section. We have the frontal or the coronal plane. So that's this one running along here. This divides the body into a front and a back, or an anterior and a posterior section. And we have our transverse plane. So this runs through the middle here, and that divides the body into an upper and a lower, or a superior and an inferior section. Taking a closer look at each of those 3 planes, and here we have an image of a skull, and this is in our sagittal plane. So it's dividing the skull into our left and our right sections. Now this is a common section that we'll use for our skull and our brain so that we can look at all the internal organs or the internal structures. Now just a bit of a note, and this applies to all of the planes, that a sagittal dissection will not always run perfectly down the middle of an object. So it might be slightly more to one side than the other, it might be slightly more to the left than the right, but the sagittal plane simply divides an object into 2 sides. So into left and a right, it doesn't matter how equal or how unequal those sections are. Our coronal plane separates the body or an object into a front and a back, or an anterior and a posterior section. So here you can see the coronal section of a heart. So the top half or the front part of the heart would usually be sitting on here. We've cut it down the middle, so now we can open it up and see inside. And our transverse section, which divides the body into our upper and lower, or our superior and our inferior sections. So in this image, we've got a transverse section of a trunk, so through the middle of the body. The front of the trunk would be here, back of the trunk is here, We've got our vertebral column and spinal column here, 2 kidneys, the liver, bottom part of the lung, pancreas, intestines, just so that you can orient yourself. Moving beyond our planes, we then have a whole other range of terms that we use to describe anatomical terminology, and you can see them all summarized, or the important ones summarized in a table here. Now, if you take nothing else from this lecture, then this table is the one thing that I want you to learn. So these are the terms that we're going to be using consistently from now on for the remainder of the semester. I don't expect you to know them right now, but these are terms that in a few weeks we will just expect that you understand. So going through each of those terms individually, we first have anterior, and this pertains to the front of the body. So you could say that your belly button, for example, is on the anterior surface of your trunk. The opposite to anterior is posterior, so this pertains to the back of the body. So your back makes up the posterior surface of your trunk. Superior is higher than another point of reference. So for example, your head is superior to your feet. Inferior is then lower than another point of reference. So your feet are inferior or lower than your head. Proximal means relatively near a point of origin or attachment. So if we give the example of your elbow being more proximal to your shoulder than your hand, your elbow is closer to the point of attachment, which is your shoulder. So your arm attaches to your body at the shoulder, and it's closer to that point of attachment than your hand. We also use the term proximal when we describe a number of our organs or the structures within our organs. So for example, we have the proximal convoluted tubules in the kidneys. So this is a tubule that first extends out of the Bowman's capsule. We also have a distal convoluted tubule. So really important, we know the difference between our proximals and our distals. Our distal then is the opposite to proximal, so it's relatively distant or further away from a point of origin or attachment. So if we take that same example, our hand is more distal than our elbow to our shoulder. Medial just means the midline of the body or the middle of your body. So for example, your nose sits medially on your face. Lateral is in our opposite to medial. So lateral is away from the middle of the body or to the side. So your ears are lateral to your nose. Superficial sits relatively close to the surface of the body. So think about the surface of the body being your skin. So for example, your ribs are superficial to your heart and your lungs because they sit on top of and closer to your skin than your heart and lungs. And then the opposite of that is deep. So deep is relatively further away from the surface of the body, deep further within you. So your heart and lungs are deep to your ribs. Prone is then describing a reclining position where you are face down. So think about doing a plank or a prone hold. Your body is reclined, but you are face down. We also talk about prone in terms of our hands. When our palms are facing down, that's a prone position of our hands. And then lastly, we have supine. So supine is our opposite to prone. So it's still a reclining body, but now you're facing up. So you're at the beach, you're sunbaking, you're looking up at the sky. That is a supine position. And so now that we've looked at the body regions, now that we've looked at those anatomical terms, it's also important that we look at our body regions. And this is particularly important for SAP when we start to describe where various organs sit within the body. So we've got this nice image here and the corresponding table. If we start at the top and look at that yellow box, we have our cranial cavity. So our cranial cavity is in our head. It's where our brain will sit within. We then have our vertebral canal. So that is the hole in which our spinal cord will run through. In the blue, we have our thoracic cavity, and our thoracic cavity is made up of 3 different sections. We have a pleural cavity. So our pleural cavity encases each lung. So we have 2 lungs. It separates those 2 lungs. We have our pericardial cavity. So peri means around, cardia refers to heart. So it's the cavity that surrounds our heart. And then we have the mediastinum. So this is a section kind of just right in the middle of that thoracic cavity. It goes from your sternum to your spinal cord. It's all the space between there. And it contains things like your heart, your esophagus, your trachea, as well as all those big blood vessels that go in and out of the heart. We then have our abdominopelvic cavity, broken up into 2 sections. Our abdominal cavity, which is kind of a bit higher up in our stomach. It contains our gastrointestinal system or our digestive system. And then our pelvic cavity, which is a bit further down, funnily enough, closer into our pelvis. And that contains our urinary system and our reproductive organs. And then just lastly for this learning objective, I wanted to briefly mention the anatomical reference position. Now this is not quite as important for systemic anatomy and physiology as it is for regional anatomy and physiology, but you do need to be aware of it. So when we describe a body position or movement in anatomy, we describe that movement or position in relation to this anatomical reference position. So imagining that movement or this person started in this anatomical reference position. So this reference position is someone standing up, looking forward, head is up, their arms are extended by their sides, their palms are facing forward, legs are straight and slightly apart, and feet are facing forward. So if someone asks you to describe, say, the position of the palms of the hand on the body, you would say that they're on the anterior surface of the body. Now your arms and your hands can move around all over the place and they may not always be facing the front of your body, but we consider the palms of the body in reference to this anatomical reference position. So from this position, the palms face the anterior side of the body. Now our final learning objective for this nice, short and sweet first lecture, and it's learning objective number 3, to be familiar with common roots, prefixes and suffixes. So roots, prefixes and suffixes are simply just parts of a word. A root is the primary meaning of the word. So for example, the root gast refers to the stomach. So whenever you hear gast something, you know that it has something to do with the stomach. So think about the gastrointestinal system. It involves the stomach and the intestines. Gastroenteritis or gastro is an illness that causes inflammation of the stomach. A gastroscopy, or an endoscopy is a medical procedure where you have a camera placed into your stomach. So anytime you hear the word or part of the word gast, you know it's relating to the stomach. Suffix is the end of the word that changes the meaning of that word. So for example, the suffix cyte, so C-Y-T-E, relates to a mature cell. So we can have a myocyte, which is a mature muscle cell. We can have a osteocyte, which is a mature bone cell. Or we could have a phagocyte, so that's a mature immune cell. So anytime you see cyte, it is a mature cell. Prefix then goes on the other end of the word, so it's the start of the word and it can modify the meaning of the root and the suffix. A nice example of that is hyper. So hyper refers to higher, increased, or beyond normal. So hyperglycemia is higher than normal blood glucose levels. Hypertrophy is an increase in muscle size. And hyponatremia is an increased concentration of sodium in the blood. Lastly, we have combining forms. So sometimes this can be a couple of letters, quite often it's only one letter, quite often it's only the letter O. And this simply combines the root and the rest of the word. So think about that example of gastrointestinal system. Gast refers to stomach, intestinal refers to the intestines, the O is that combining form. So gastrointestinal system. Now, just to visually show you that kind of breakdown of the word, we have another example here. So this is the term hyperthyroidism. Hyper, we've discussed, refers to higher than normal or increased. Thyroid simply refers to our thyroid gland. And ism means that it's a condition. So without even knowing what the term is, having never heard of this term before, you can roughly work out that it is a condition of an overactive thyroid gland. So now, as you are doing any revision or reading for this unit, I want you to start breaking down words like this. Can you work out roughly what these big long words are relating to? Now, taking a look at some common roots, prefixes and suffixes, and yes, I know that this column only has the title root, but all of these are either a root, a prefix, or a suffix, just so that you can start breaking down some of those words. So our first one we have is ab. It means from or away from. Think about the movement abduction. It's moving a limb away from your body. If you abduct a person, you take them away. We have bi. So bi just means two. We have our bicep brachii muscle, which has two heads. A bi-weekly meeting would be either twice a week or once every second week. Exo denotes as something outside something else. So we have a exoskeleton. So for example, the exoskeleton of a bug is that hard outer layer that's on the outside. If we think of exocytosis, it's that movement of a substance outside of a cell. Hyper, we've already talked about, so it refers to something that is increased or beyond normal. So for example, hypertension is high blood pressure. Hypo is the opposite to that, so it refers to something that is below normal or low. Hypoglycemia then refers to low blood sugar. Potentially a little bit silly, but something that always helps me remember the difference between those two is I think about a hyperactive child. They're running around doing lots of things. They've got increased levels of energy, so it's hyper. And then hypo, low kind of sound the same. Both got O's. So hypo, low is when something is lower or reduced. We then have supra, which is a bit of a shortened word for superior. It's referring to something that is above. We have our supraspinatus muscle, which sits above the spine of the scapula. The opposite to that is then infra, which is relating to inferior or below. Our infraspinatus muscle then sits inferior or below the spine of the scapula. Inter means between or among. So the intercostal muscles sit between the ribs. The interventricular septum is a septum or the bit of tissue between the two ventricles of the heart. Itis refers to inflammation. So tonsillitis is inflammation of the tonsils. Pericarditis is the inflammation of the membrane that surrounds the heart. Peri we've briefly mentioned already. It denotes something that surrounds or is around something else. So our periosteum is the covering which surrounds the outside of a bone. We have the pericardium, which is the membrane that surrounds the heart. Myo refers to muscle. So a myoblast is an immature bone cell. Myocarditis is the inflammation of the muscle of the heart. Ost refers to bone. Osteoporosis is a bone condition in which bones are very porous. Chond or chondro relates to cartilage, so a chondroblast is a immature cartilage cell. Blast, which we've heard a little bit already, is a immature cell. So an osteoblast is an immature bone cell. We can have a myoblast, which is an immature muscle cell. And lastly, the opposite of that is our cyte. So this denotes a mature bone cell. So an osteocyte is a mature bone cell. So that is all of the terms that we have for today. I know that is a lot for only a 20-minute lecture. I hope your brain doesn't feel like it's going to explode too much. Just know that I don't expect you to remember all of that right now, even today or next week, but I do want you to start trying to become more familiar with them, start trying to use those terms when we're in the labs and when you are doing a revision. Hopefully that wasn't too much of a baptism of fire if you haven't studied any anatomy and physiology before. But remember, if you have any questions, send me an email. Otherwise, you will hear from me in the next lecture. Thanks.